This is what, week 4? So it is Tuesday the 15th of October. And tomorrow I start, I have to start taking my steroids. I take 2 doses the day before chemo, 2 doses the day of chemo, and then 2 doses the day after chemo. And then Thursday, I start chemo. I've been, I didn't know if I wanted to do it, and then while I was trying to figure out if I wanted to do it, I had to play the waiting game with the doctor, or chasing them down. So, I guess I'm doing chemo. Because it's been such a delay, hopefully there's been no regrowth. Because as far as my surgeon was concerned, she said no more surgery for me, that they had removed everything. Like the lump was like right here. And I can't show you the scar here on YouTube because they think it's a sexual video and they remove it. On Instagram, I've shown the scars. The scars. And they fucked it up. I haven't done an update because nothing really looks different than what I've shown last in an Instagram video. But so what they did is, like, you have the skin right here, what they call the areola. So what they do is she cut around the outer circumference, the outer area where the skin meets the areola, so it looks like it's just been cut around it, which she did a really great job. I thought she was just going to go right on top of the lump, and she didn't. Aesthetically, that's great. The only thing that I think I've experienced as far as look-wise what's different is that skin, that areola, is kind of really pale now compared to the other one. It's more like a pinky flesh tone. This is more like a pale color. That's the only thing. So the chemo is starting on Thursday, and last night, I think yesterday, I think it kind of hit me that this next phase is going to begin, and never being through it, I don't know what to expect. Now, we all know that your typical chemo effects are, your hair falls out, you get sick, and you look like a cancer patient, right? And I don't really care. I mean, I don't want to get sick, but I really hate throwing up. I really hate throwing up. And apparently you can get diarrhea from it too. And your bones can hurt. Your bones can ache. I can't remember if I already discussed some of the side effects. Let me go get my paper. Hold on. So, I'm reading the papers here. So on chemo, in case you don't know, chemotherapy is a cancer treatment that uses drugs to destroy cancer cells. It may also affect your healthy cells. These drugs are sometimes called anti-cancer drugs or chemo. These drugs will destroy existing cancer cells, stop the cancer cells from spreading, and slow the growth of cancer cells. Chemotherapy can be given in many ways. Some common are intravenous, which is, in your vein. The two most common types are implanted ports, or, the in your vein. The port would go, I think, somewhere over here. I don't know. I did not choose that option. I had the option. I had a more intense chemo I could choose, which would include the port. Maybe it goes up here. I don't know. Or the less intense, which is through the vein, and I chose that one. Takes longer, I think, week-wise, but I'm less likely, or I won't be as sick, won't get as sick, throwing up, I mean, and I don't need a port. There is oral, which is what I was hoping for, but which is chemotherapy that is taken by mouth, such as pills, capsule, or liquids that you swallow. And I don't know what stage that, if it's the higher stage you go. Intracavitary chemotherapy that is given directly to a body area. Topically, which is chemotherapy that is placed on the skin and absorbed, which I've never really heard anyone talk about that. Arterial chemotherapy that is given directly into the artery. Intrathecal chemotherapy that is given directly into the spine or brain. Biotherapy, biological therapy or targeted therapy is a cancer treatment that uses the body's own immune system to stop or slow down the growth of cancer cells. These treatments use substances made from living organisms to treat cancer. Some biotherapies work by stopping the blood supply to a tumor or by interrupting signals within the cancer cell. Types of biotherapies are monoclonal antibodies. These drugs target only cancer cells and have minimal effect on healthy cells. Cancer vaccines help the body fight to keep cancer from coming back. Growth factors, which help your body recover from the effects of treatment. Immunotherapy, this is the newest type of biotherapy. There are many types of immunotherapies. One is a checkpoint inhibitor, which are drugs that help the immune system respond more strongly to a tumor. They work by releasing the brakes, keeping the T cells from killing cancer cells. They do not target the tumor directly, but make it sensitive to attack from the immune system. Adoptive cell transfer. This treatment attempts to boost the natural ability of your T cells to fight cancer. Cytokines, proteins that play an important role in the body's normal immune responses, including the immune system's ability to fight cancer. These proteins are called interferons and interleukin, whatever. What I'm doing is a drug called pegfilgrastim or epletigrastim. I'm reading the phonetically broken down. It is used to prevent and treat low white blood cells, which is a possible side effect of cancer treatment, and has been used to treat other diseases. This treatment works by helping your body to make more white blood cells to prevent or fight infection. So it's available in two forms, which is a prefilled syringe or on-the-body injector. Your provider will give this treatment by injection just under the skin. Your provider may give your injection in the office or clinic, or may give you instructions to inject yourself at home. As far as I've been told, I have to go after each chemo treatment. I have to go into the office and they're going to do it for me, so I don't do it myself. Typically at least 24 hours after you receive chemotherapy. So the side effects from this, some of them are joint, muscle, or bone pain, pain, swelling, or redness at the injection site, loose stools, headache, fatigue, rash, itchy skin or other skin changes, decreased red blood cells, which is anemia, decreased platelets, and increased risk of bleeding. That'll be fun. No food or drug interactions. So these are the things that really concern me about doing chemo, is the side effects to the rest of your body. This treatment can also cause other serious side effects, including an allergic reaction, rash, itching, facial flushing, chest pain, trouble breathing, dizziness, fainting, or swelling of the lips, throat, or tongue. Kidney problems. Tell your provider if you have difficulty urinating or a decrease in the amount of urine. If you have kidney problems, your treatment may need to be changed or stopped. Capillary leak syndrome. In rare cases, this treatment can cause fluids and proteins leak out of your blood. This can cause very low blood pressure and fluid retention. Tell your provider right away if you have a headache, dizziness, shortness of breath, or swelling of the arms, legs, hands, feet, or face. Spleen problems. In rare cases, this treatment can cause an enlarged or ruptured spleen. Contact your provider right away and seek emergency care. Blah, blah, blah. Let them know if you have pain in your left shoulder or the upper left part of your abdomen. Lung problems. Contact your provider right away or seek emergency care if you have shortness of breath, difficulty breathing, or a racing heart. Heart problems. In rare cases, this treatment can cause inflammation of the aorta, a large blood vessel that carries blood from the heart to the body. Contact your provider if you have a fever, abdominal pain, back pain, or are feeling more tired than usual. I'm not pregnant and I'm not breastfeeding, so don't worry about that. So that is from the infusion the day after chemo. Let's go back to the chemo, shall we? So they say labs are required before most cancer treatments, which is they do a CBC, which they draw the blood from you, and they do a complete blood count. They monitor how your bone marrow is being affected by the treatment. If your hemoglobin and I don't remember that one. Whatever. HH. If they are low, this indicates anemia. You can experience lightheadedness and fatigue when you're anemic. If your white blood count is low, this indicates neutropenia. Neutropenia. If your neutrophils are too low, you're at high risk of infection. Sometimes you might be given a white blood cell booster shot the day of or the day after your treatment to boost your white blood cell count. I believe that's what I'm doing. If your platelet count is low, this indicates thrombocytopenia. This can cause you to bleed more easily. If you're told your platelet count is low, you will be asked to call for bruising or bleeding, like if you experience that. A complete metabolic panel is the second most common lab test that is run. Don't know if they'll be doing that. I don't know. This allows the team to monitor how well your kidneys and liver tolerate the treatment. Probably. It's also to let them know if your electrolytes are normal. Some cancers have tumor markers that can be followed, helping your team know how well you respond to your treatment. Because they remove the tumor, I don't know if that's going to be something that I don't think that's going to be anything that's going to go with my case. The day of treatment. Eat a light breakfast and or lunch. Eating before your treatment can help reduce your risk for nausea and or vomiting. Treatment drugs tend to slow the digestion and bowel process and make patients more prone to constipation. Yay! You can bring food with you to snack on during your infusion. Stay well hydrated the day of and for 3 days after each treatment. Staying hydrated during the treatment will help reduce the chances of developing constipation post-treatment. We recommend 8 to 10 8-ounce glasses of fluid daily. Includes water, tea, juice, and other non-caffeinated, non-carbonated beverages. I'm going to be drinking coffee. You can fuck off, okay? I only drink like 1 cup of coffee a day, and if you think I'm not going to have coffee, you can go straight to hell. I say that now. Maybe if I see that it affects me negatively, maybe I won't, but I probably won't have any the day of this first round, but you can be guaranteed I'll be drinking coffee. Post-treatment. Now that you've received your cancer therapy, the focus turns to monitoring for the side effects you may experience. Yada, yada, yada. So there's fever and infection. If you have a fever, I'm not going to read everything, but if you have a fever of 101, with or without chills, call your doctor immediately. If you cannot reach the office or on-call position, go to the emergency room. Keep a thermometer in your home. Please do not eat, drink, or smoke for 10 minutes before taking your temperature. I wonder why smoking has something to do with that. Call the office if you develop a cough, sore throat, or pain when you empty your bladder. Help prevent infection by frequent hand washing with soap and water or using hand sanitizer. Avoid rectal intercourse, tampons, douches, enemas, and rectal thermometers. No freaky deaky stuff, apparently. Do not eat raw foods such as sushi, salmon, carpaccio, Caesar salad, or milkshakes with raw eggs. Fresh fruits and vegetables are okay when washed thoroughly before eating. Wash hands and cutting boards well after food preparation. Flu-like symptoms can be experienced around the 3rd day after treatment. Okay, so I have plans on, so Thursday, 3rd day after, so Friday, Saturday, Sunday. Wonderful, I have plans on Sunday. This is going to be fun. 3rd day after treatment. This usually presents as muscle aches and pains. If you have any of these symptoms, you can take over-the-counter medications such as acetaminophen, Tylenol, or Aleve. These do not work. Please get in touch with the office. Nausea and vomiting. Not all cancer treatment drugs cause nausea and vomiting. If you are receiving a regimen that causes nausea, you'll be given medications based on your treatment for control. They already gave me some, so obviously, yeah, they told me I will get sick a little bit. Hey, Mama. You come say hi? Come here. Come here. Come here. Oh, come say hi. You say hi? Alright. Sorry. They already gave me the medication for in case I get nausea. Management of nausea and vomiting related to cancer consists of a two-prong approach. The first occurs in the office when you get your infusion. Before each treatment, you'll be given anti-emetics and anti-nausea drugs via the IV. The second is by providing you with prescriptions to take home. Some things to follow are follow a healthy, well-balanced diet that is high in protein, high in healthy fats, and contains minimally processed foods when you are nauseated. Your basic stuff. Aim for 6 meals or snacks per day. Small meals are easy to digest. You can supplement with Boost, Ensure, and or homemade protein shakes. Eat what sounds good to you. Eat soft, bland, easy to digest foods such as rice bread, potatoes, hot cereals, and puddings are all well tolerated. That's all fine and good, but everything there is, I'm diabetic, and that's all carbs. Which I love all those things, but this is going to be fun. Hopefully I'm not going to get too sick. Try not to skip meals. An empty stomach will worsen all symptoms. Avoid smells that are unappealing as they can cause nausea. If you have nausea and the prescription medication is not working, or experience vomiting, please get in touch with the office. Fatigue. Cancer treatment can make you feel tired. Tiredness is the most common side effect experienced by all patients undergoing treatment. Fatigue may or may not worsen as you receive more treatment cycles. The fatigue may require an adjustment in your work and home life. Try to continue your everyday activities as much as possible to help reduce fatigue. Your fatigue will go away after you complete your treatment. Some practical hints to follow are plan your activities such as grocery shopping for a time when you feel the best. This is usually in the morning. Take naps early in the day if needed, so you do not disturb your sleep pattern at night. I have no sleep pattern, so it doesn't matter. That don't help. Consider exercising every day or several days a week. Good forms of exercise include swimming, walking, and yoga. And you're interested, classes are offered at The Caring Place. Never heard of that place. Their contact number, The Caring Place. Good to know. I don't have a car though, so Good to know. Hair loss. Many people feel that hair loss is one of the most difficult aspects of cancer treatment. All cancer therapies cause you to lose your hair. I'm told the one I'm on, I will. If you're receiving a drug that can cause hair loss, it usually begins to fall out 2 to 3 weeks after starting treatment. Some people may only have thinning of their hair, but others can lose all their hair over their entire body. Some people want to cover their heads, but sometimes the scalp can be very tender and wigs may not be the best option. Consider scarves, hats, or turbans as an alternative. Sometimes the hair follicles can get irritated due to ongoing changes, or you may develop a condition called folliculitis. This presents as tenderness, reddening, or swelling of the hair follicles. If you notice this, please notify your team. You may need to be placed on antibiotics. Skin changes. Your skin can be affected by your treatment. This also includes your nail beds. My nails suck anyway, so this is going to be even better. You will need to protect your skin from the sun and keep it healthy. Some chemotherapy drugs can cause a specific skin reaction called hand-foot syndrome. This is characterized by redness, tenderness, and peeling of the palms and soles of the feet. It can be very uncomfortable. Some medications can also cause rashes. Some practical hints to follow are: use only mild soap emulsions and creams that do not contain fragrance. Avoid alcohol-containing products as they can dry out skin. Use sunscreen with an SPF of 30 or higher when outside to reduce the risk of burning. Keep your nails short and clean. Check with your provider to see if it is okay to get manicure or pedicures. I don't do that anyways. Bathe, shower in warm, not hot water. Wear gloves when you wash dishes, work in the garden, or clean the house. If you notice any changes in your skin and or nails, please contact your team for instruction. Appetite and taste change. It's common to experience appetite and taste changing while undergoing cancer treatment. Some patients may not have an appetite for up to 1 week after treatment. This is very common, and your appetite will improve as you feel better. Some patients may experience reflux due to changes in eating. The burping or burning sensation caused by reflux can decrease your appetite to eat also. Please monitor for these symptoms and call the office if you experience them. Some hints are: eat healthy and nutritious foods that appeal to you. Focus on minimally processed foods that are low in fat. Eat foods that are high in whole grains. Eat plenty of fresh fruits and vegetables. Avoid seasoning to make food. Add seasoning to make food taste better. Make dietary changes based on your body and experience. Some patients do better with a slow change in their diet. Some benefit from a major overhaul at the beginning. There is no right or wrong way. We need to make sure you are eating to stay healthy during your treatment. Drink plenty of fluids, 8 to 10 8-ounce glasses. Water, juice, flavored waters. Please avoid carbonated drinks such as soda and drinks high in caffeine. Alcoholic beverages can be consumed on an occasional basis. So you can drink booze, but don't have coffee. Okay. Good to know. I guess maybe instead of a cup of coffee in the morning, I'll have a glass of wine. All right. I did that last week. It was actually interesting. And don't be surprised if you gain weight during the treatment, as this is not unusual. So even though you're probably sick as a dog and not eating, you can gain weight. Cute. Diarrhea or constipation. Every patient will experience one of these symptoms throughout the course of the treatment. Some cancer therapy drugs cause diarrhea, some cause constipation. It's important to be prepared for either. Your team will let you know the most common based on your treatment plan. For diarrhea, notify the office if you experience more than 3 to 4 loose, watery stools in a 24-hour period, especially if you're on an immunotherapy drug. You must take, you take, wow, I should say you may take Imodium AD when you start having diarrhea. Take 2 tablets followed by 1 tablet every 4 hours. or after each watery stool. Do not exceed 12 tablets within a 24-hour period unless directed by the doctor. Continue until you are without diarrhea for 12 hours. Last over 12 hours, with the emotum, contact the office. Following the brat diet, when you have diarrhea. This diet, oh, here we go. No, not bread, sorry. This diet consists of bananas, rice, applesauce, tea, and toast. Not bread, banana. It would help add bulk to your stool and slow diarrhea. Avoid foods that can cause gas, such as broccoli and cabbage, when you have diarrhea. Avoid dairy-containing foods, as they may cause diarrhea, as they may make diarrhea worse. Increase your fluids to 12 8-ounce glasses of clear liquids. For constipation, eat a diet in high-fiber foods such as prunes, bran, fresh fruits, vegetables, to keep your bowel movement regular. Take a stool softener laxative regularly will help decrease the risk of constipation. Some over-the-counter medications to try are Miralax, Colace, milk of magnesia, mag citrate. Being active with 15 to 30 minutes of activity every day can help. Drink 8 to 10 glasses of fluid every day to help prevent constipation. If you've not had a bowel movement in 2 days and none of the above recommendations are working, please call the office. You can get stomatitis, mouth sores. These occur during the cancer therapy. These occur due to the cancer therapy affecting the cells that line your mouth and esophagus. They can cause some discomfort when swallowing and eating. Some practical hints to follow are: brush your teeth with a soft toothbrush 3 times daily. Avoid commercial mouthwash, as most of them contain alcohol, which I'm sure would burn the hell out of you. Rinse with a solution of 1 teaspoon of baking soda and 1 teaspoon of salt diluted in warm water 3 to 4 times per day will help with the pain. Using over-the-counter products such as biotin, ulcer ease, or ACT products can also help. Avoid eating foods that will irritate the ulcers, such as citrus fruits, crunchy or sharp-edged foods, and spicy foods. Eat soft foods such as scrambled eggs, mashed potatoes, and soups, as these will not irritate the mouth and throat when swallowed. Contact your provider if you're having problems swallowing due to the mouth sores, and there are prescription mouthwashes that can be provided. Neuropathy. This is a malfunction of the nerves that can cause patients to experience burning pain, numbness, and or tingling. This can happen in the hands, feet, or both. Certain chemotherapy drugs are known to cause neuropathy. Some patients will not notice the numbness and tingling, but may notice changes in their fine motor skills, picking up objects, buttoning clothes, and or tying their shoes. Some practical hints to follow are: wear loose, soft cotton socks and padded shoes if you have symptoms in your feet or toes. For burning pain, place your hands in cold water twice daily for 15 minutes. Massaging your hands and feet can improve circulation and temporarily relieve pain. Contact your provider. If you notice a significant impact on your activities of daily life, as you might need medications to help alleviate the symptoms, your medical oncologist may adjust your treatment at your next visit. Sexual and fertility health. Well, I'm not having sex, so this really doesn't pertain to me, but I'll read it just in case. And nor am I trying to get pregnant. Cancer treatment can cause changes to your sexual health and fertility. If you are still of childbearing potential, be sure to talk with your physician before starting treatment. You can discuss the risks so the appropriate measures can be taken to preserve your fertility and ability to have children. I'm 50. I don't really want kids anyways. I think I'm good on that. Not a concern. For women, cancer treatment can be harmful to an unborn fetus. Make sure that you and your partner are using birth control. Make sure your partner wears a condom during intercourse, as cancer therapy drugs may be in your vaginal fluids. You might experience dryness, itchiness of the vagina, hot flashes, frequent vaginal infections. Yay for me. Irregular menstrual periods or no periods. I'm at the age where I don't know what the fuck's going on with mine, so I don't know if it's going to kickstart it again or make it even more prone to not be here. It's been since February, I think, since I've had one. And I'm good with that. Please don't start again, because that will kick me back into having to start this thing all over again, because if you're going to be in menopause, you have to have a whole year without having a period. Stress and fatigue, did you need to know that? No, sorry. We're all friends here, I share everything. Stress and fatigue causing a decreased interest in sex. Actually, you know what, that usually makes it... Anyways, it's usually a good stress reliever for me, but, you know, like I said, I'm not having... Anyways, maybe it's why I'm so stressed out all the time and angry. Could be. If you experience... Right? I mean, just saying. If you experience any of the above symptoms, please talk to your provider. They may be able to give you medications. Being honest with your partner about how you're feeling has also been shown to help manage these issues. For men, always use a condom when having sex. Cancer therapy drugs may be in your semen. You might experience difficulty achieving or maintaining an erection, inability to have an orgasm. Stress and fatigue cause a decreased interest in sex. If you experience any of the above symptoms, please talk with your provider. They may be able to recommend or prescribe medications that can help. Being honest with your partner, same old, same old. Pain management. Cancer patients can experience pain anytime during their therapy. It is also important to notify your team if you begin to have pain, notice changes in your pain, or if your pain medication is not working as well as it has. These could be signs of something is changing with your cancer, which needs to be investigated. Many non-pharmaceutical interventions can be beneficial if you don't want to take a prescription pain medication. Some practical hints to follow are the non-pharmacological techniques are hypnosis, including guided imagery, distraction, and relaxation. Comfort therapy, including companionship, exercise, meditation, music, art, pastoral counseling, and massage therapy, if okay with your provider. I guess maybe. So the massage therapy, I'm assuming maybe it depends if you have a port or where your cancer is, maybe. Physical occupational therapy, including aquatherapy, desensitization, is, good God, I can't talk. Desensitization, whatever, you know what I mean. And toning and strengthening. Psychosocial therapy counseling, including individual or group therapy, neurostimulation, including acupuncture and acupressure, complementary medicine, including topical CBC or other essential oil designed for pain relief. Pharmacological techniques are opioid pain medications. They can cause side effects such as constipation. There's anti-inflammatory drugs, and then there's antidepressants. Other information. Integrative oncology is defined as the use of complementary or integrative therapies along with conventional medicine. These therapies work together with standard treatment methods to treat not only the body, but the mind and spirit as well. Integrative therapies can help meet treatment goals, treat side effects, relieve stress, and may help with treatment results and adherence. Defining the terms are conventional cancer therapies. Treatments that are widely used have been proven useful in clinical ways. May include surgery, chemotherapy, radiation therapy, and hormonal therapy, often called standard of care. Now I'm going to be doing all of those. Complementary and alternative medicines and practices, CAM for short, not considered standard care, not considered standard treatments, though many can be useful to cancer patients. They fall into two categories. Complementary medicines, not meaning free, I mean it complements. Like, ooh, free CBD? Um, they are cancer therapies used alongside conventional medical treatments. For example, acupuncture and guided imagery may be used to ease nausea caused by chemotherapy. Alternative medicines therapies that can be used instead of conventional medical therapies, for example, getting vitamin infusions to treat cancer instead of standard therapy provided by the oncologist. Modalities that are thought as integrative therapies: mind-body methods, mindfulness, biofeedback, congenital behavioral, not behavioral therapy, medication, relaxation, guided imagery, hypnosis, yoga, music therapy, creative expressive therapies, and spirituality. Biologically based practices, which are vitamins, herbs, foods, and special diets. Body-based practices, massage, chiropractic interventions, and reflexology. Energy medicine, which is Reiki, Tai Chi, Ginseng Jiu-Jitsu, or therapeutic touch. Other medical delivery systems, Chinese medicine such as acupuncture, homotherapy, and naturopathy. Now, I do like to do things homeopathically instead of taking like medicine all the time. So, like I don't go to anybody for that, but I used to work for Whole Foods for like 15 years or so. So I'm pretty, and I'm taking this thing. I'll show you right now. This stuff is called soursop. This is supposed to be for. Oh, where am I? Hello. This is supposed to be for healthy cells. And then a thing called. I still can't ever say it. I'm going to spell it Shilajit. Also kind of the same thing. It's supposed to be good. It's from Himalaya. It's Himalayan, I should say. Also same benefits and stuff. I've been taking those for a couple of months. I've actually been really bad. I haven't taken them like in the last month, but there's different forms you can take them. I started taking those before I did my surgery. And then there's other stuff you can take too. I'm gonna have to ask them if I can take like echinacea and stuff like that to help with my immune system, stuff like that, because I have plenty of that too. Precautions with integrative oncology. Many of these therapies help ease side effects and support the patient's well-being. Unfortunately, for many of these therapies, we are not certain of what risks, if any, they pose. Be sure to notify your provider of any integrative therapies you might be using before starting any treatment. Some of these therapies are not without their own certain side effects or may worsen known side effects from conventional treatment. So I'm going to have to ask them about those. Vitamins, herbal therapies, and supplements do not need FDA approval. Thus, they are not regulated to the same standards as conventional medications. This can lead to batch impurities that can cause safeguarding issues. One way to help reduce the risk is to buy from reputable manufacturers or those verified by USP, the United States Pharmaceutical Convention. Be mindful of safety concerns for some mind, body, and body-based practices depending on your situation. Avoid deep tissue massage in areas of swelling or acupuncture. Okay. If your immune system is low. Okay, that answers my question. On the massaging. The key to integrating conventional treatment and complementary alternative medicines is to talk with your healthcare team. Some CAM treatments are compatible with conventional therapy and some are not. Genetic counseling. A cancer genetic counselor offers assistance and counseling for those who are at risk for developing cancer. They can help make informed decisions about which genetic tests to get based on your family history. They also work with you to develop a plan of action should your risk assessment reveal a predisposition to a certain cancer type. Your physician may recommend an appointment based on your history, or you can request one. Please talk with a member of your team. I already had that. I had to have that before I could have surgery. And I came back positive with the BRCA gene 1. meaning I don't have a high risk of it returning. Or I think if I had BRCA2, they would have probably recommended getting a mastectomy or a double mastectomy. But because I am BRCA1, I could have done that, but I opted not to. And everything else that came back from my test, they tested for pretty much everything because I've got all kinds of cancer on both sides of my family. I came back negative with everything, so, which is good. So that is the introduction to cancer therapy. Now, the medication, the chemo I'm doing is dose Taxol or Taxotere, and then cyclophosphamide or Cytoxin. They both prevent cancer cells from dividing and growing and can cause the cancer cells to shrink and die. How will I get the treatment? It says keep a list of all over-the-counter products you take, including vitamins, dietary supplements, herbal medicines, and homeopathic remedies. Share this list with your provider at every visit. Always tell your provider pharmacist before you start any new prescription or over-the-counter product. Like I said, I haven't been taking anything, so I'm pretty good. I would like to know if I can take those, though. Your provider will give you your treatment by injection into a vein. Your provider will decide the number of treatments you will need. As far as I'm aware, I think it's 4 and 4, so 4 treatments. I don't know why they say 4 and 4, because it's every 3 weeks. So I should be done in December. Some of the drug that you receive may present in body fluids, such as urine, stool, sweat, or vomit. Wash your hands with soap and water after touching linens or clothing that may be soiled with body wash or body waste. Drug and food interactions. This treatment has many possible drug interactions. Please tell your provider or pharmacist before you start any new prescription, over-the-counter product, or supplement. Treatment may change the effects of certain blood thinners, such as warfarin. It is very important to tell your provider if you're taking warfarin or other blood thinners so that they can check your blood's ability to clot. Not any of that. This drug may interact with grapefruit juice, and starfruit. Avoid eating or drinking these before your treatment. I hate grapefruit, so I'm good. That's the only food. What are the possible side effects? All drugs can cause side effects, but each person reacts differently to each drug. The following chart will list the possible side effects that can occur with your treatment and how to manage and minimize them. This chart does not include all possible side effects. If you experience any side effect that is not listed below, contact your provider. If any side effect is severe and manageable, contact your provider right away. So, decreased white blood cells and increased risk of infection. It's common. Wash your hands often. Brush and floss your teeth daily. Clean any cuts right away. Stay away from crowds or people with colds or other illnesses. Make sure to cook foods thoroughly. Again, if you have a fever, chills, contact your provider. Fatigue or decreased red blood cells, anemia. Plan rest periods throughout the day. Organize daily activities to conserve your energy. Try to eat a well-balanced diet and drink plenty of fluids. Stand up slowly to avoid getting dizzy. Decreased platelet and increased risk of bleeding. Do not take aspirin or anti-inflammation drugs such as ibuprofen or naproxen without the approval from your provider. Now this I have to talk to them about because I get headaches and I get migraines. Use caution with sharp objects such as razors and nail cutters and probably knives. Avoid activities that can cause cuts, bumps, and bruises. Brush your teeth gently with a soft toothbrush and maintain good oral hygiene. When shaving, use an electric razor instead of razor blades. If you bruise, put ice on the area for about 20 minutes. If you start to bleed, press firmly on the area with a clean cloth until it stops. Contact your provider if you have any unusual bleeding, easy bruising, or tiny red spots on your skin. Nerve problems, neuropathy, may present as numbness or tingling sensation in fingers, hands, toes, and/or feet. In some cases, it may also affect muscle control or balance, which is great because I already have bad balance control and I trip and fall over air. Try and stay out of the cold and extreme heat. Well, this is Vegas, and luckily, it's not 115 anymore, so I think I might be good. Wear mittens or gloves, socks, and scarves. Use caution with sharp objects, probably because you can't feel if you're going to cut yourself or stab yourself or hurt yourself. Be aware of hot coffee mugs, pots, and pans, and water. You may not feel the heat until you're burned. Makes sense. If you feel unsteady on your feet, be careful on stairs and in the shower. I always take baths because, like I said, I can trip over air, and one leg is shorter than the other, so I have balance problems, and I'll slip and fall. Consider moving area rugs so you do not trip. Consider putting non-slip bath mats in your tub and shower. Fluid retention. Check your weight often. Try not to eat salty foods. If your feet are swollen, put them up or go for a walk. Hair loss. I already know that's going to happen. You may not be able to prevent hair loss. Here are some tips. Use a soft hairbrush that does not use and do not use brush rollers. Color your hair or get a perm. I already colored my hair a couple days ago. Do not wash your hair every day, and when you do, use a mild shampoo. Now that it's not hot out, I don't do that anyway, so if I can avoid it. Do not use a hair dryer or use a low setting. I don't really do that. If you choose to shave your head, use an electric shaver to avoid cutting your scalp. Check if your insurance covers a wig, and then ask your provider for a wig prescription. Use a sunscreen or wear a hat or scarf to protect your scalp from the sun. Rash, itchy skin, or other skin changes. Do not stay in the heat for long periods of time. Again, this is Vegas. How the hell are you going to avoid that during the summer? Or basically between March or April till here in October. How are you going to do that? You can't. Use creams or moisturizer often and try wearing cotton gloves. Do not use perfume, cologne, or aftershave. These products can irritate the skin. Fuck you. Try to stay out of direct sunlight and do not use tanning beds. Wear protective clothes, a hat, sunglasses, and sunscreen with an SPF of 30 or higher when outside during treatment. Nail changes may include darkening, brittleness, vertical or horizontal bands on the nails, or infection of skin around the nails. My nails are brittle as they are. God, please don't get worse. Trim nails often and keep them clean. Wear gloves for cleaning and gardening to help prevent infection. Keep hands out of water or use waterproof gloves for wet work. Use antibacterial soaps and apply lotion after washing hands. Avoid wearing nail polish or false fingernails until the nails have returned to normal. I don't really do nail polish. Nausea or vomiting. Eat small, frequent meals and bland foods like banana, rice, applesauce, or toast. Eat food cold or at room temperature to minimize smells. Do not eat fried, spicy, or fatty foods. Drink plenty of liquids during the day. Anorexia or appetite loss. Try eating 6 to 8 meals or snacks each day instead of 3 large meals. Vary your diet and try new foods and recipes. Take a walk before meals when possible. This may make you feel hungrier. Cook meals ahead of time and freeze them to minimize cooking smells. Add mild spices to change flavor. Loose stools. Eat small, frequent meals and bland foods like banana, rice, applesauce, or toast. Avoid foods that can cause or worsen diarrhea, such as high fiber or high fat foods, spicy foods, raw eggs, undercooked meats, milk and dairy products, caffeine, alcohol, or food left unrefrigerated for more than 2 hours. Do not take laxatives or stool softeners. Drink 8 to 10 glasses of clear liquids every day. Mouth sores and pain. Brush your teeth 2 to 4 times a day using a soft bristle brush and fluoride toothpaste. If you wear dentures, make sure they fit well and do not wear them overnight. Ask your provider to suggest a mouthwash that does not contain alcohol. Sip water during the day and use sugar-free candy or gum to keep your mouth wet. Use lip balm to keep your lips moist. Eat soft or pureed food. Do not eat foods that are acidic, spicy, salty, dry, or rough. Do not smoke or use other tobacco products. Less common are joint or muscle pain. Warm showers or bath or a warm compress can help ease pain. Keep a diary of your pain and record when and where the pain happens, how severe it is, and if any pain medicines you've taken. Share your pain diary with your doctor. Other possible side effects: changes in taste, abdominal pain or constipation, headache or dizziness, kidney problems, pain, swelling, or redness at the injection site. This treatment can also cause serious side effects, including allergic reaction. Tell your provider right away if you have rash, itching, facial flushing, chest pain, trouble breathing, dizziness, fainting, or swelling of the lips, throat, or tongue, bleeding in the bladder. Ask your provider about drinking extra fluids and emptying your bladder often to reduce the risk. Contact your provider right away if you have blood in the urine or painful, frequent, or often or difficult urination. Liver problems. Talk to your provider if your skin or eyes look yellow, your urine turns dark, or you bleed or bruise more easily, or you have stomach pain. Eye problems. Talk to your provider if you have blurred vision, eye pain, eye redness, or swelling. If your eyes are sensitive to light. My eyes are already sensitive to light, so please don't make them worse. Like, seriously, I have to have sunglasses on when I go outside, even if it is rainy and overcast. Because the side does not close, like ever, see? So I can't blink and I can't squint. So this eye overcompensates, and because this eye cannot close or squint, it's very hard to be in bright light. Tumor lysis syndrome, TLS. Your provider may give your medicine to help prevent this side effect. Drink plenty of water and or non-caffeinated fluids during the first few weeks of your treatment to help protect your kidneys. Tell your provider right away if you have trouble urinating. Swelling or infection of the intestines. Oh, Jesus Christ. Tell your provider right away if you have more bowel movements than usual, bloating or swelling in the stomach, constipation, vomiting, fever, stomach pain, or dark, black, or bloody stools. Heart problems. Contact your provider right away if you have chest pain or pressure, flushing, shortness of breath, a cough, swelling of the hands or feet, or an irregular heartbeat. Now, with heart problems, I've read that you can have long-term, like it can damage your heart doing chemo. Which we have heart problems in my family as it is. That's one of the reasons why I was not sure if I wanted to do chemo, is the long-term effects on your organs. I know I'm not looking at the camera, I'm sorry. Lung problems. Contact your provider right away or seek emergency care if you have shortness of breath, difficulty breathing, or a racing heart. Impaired wound healing. This treatment can cause wounds to not heal or to heal more slowly. I'm already diabetic, so I can already have that problem. I hope it doesn't make it even worse. Not that I get a lot of wounds. Severe skin toxicities. Tell your provider right away if you have swelling around the eyes, a severe rash, or a rash that looks like pimples or blisters on the skin, in the mouth, or on the genitals. What the fuck? Jesus. Alcohol exposure. Some types of this medication contain alcohol and can cause intoxication. What? If you receive a type of it that contains alcohol, use caution when driving or operating machinery. So you're telling me that if you get the kind that has alcohol, you could get pulled over and you could be tested positive for DUI when you haven't drinking anything? That's a little concerning. I don't drive because I don't have a car, but for people that do drive, I've never heard that before. Secondary cancers. This treatment can cause certain types of cancers years after treatment. Talk with your provider about your risk of other cancers. Where's my pen? I need to circle that shit. Alright, we're gonna explain that one for me, and then explain the alcohol. Pregnancy and breastfeeding. Both things I don't have to worry about, but good to read anyways. Use effective birth control during your treatment. A woman should continue effective birth control for 1 year after treatment ends. Men should use a condom during treatment and for 4 months after treatment ends. This treatment could harm an unborn baby. Tell your provider right away if you or your partner becomes pregnant. Do not breastfeed during treatment and for 1 week after treatment ends. One of the drugs passes into the breast milk. It is not known if the other one does. How do you not know? How do you not know that? Can't you test it? I feel like that's something that should be known. And why can't you test it? Doesn't seem that hard. You test it. What the fuck? It is safe to hug and hold hands. Good to know. You may have concerns about intimacy and sexual activity during and after treatment, or you may notice changes. Talk to your provider if you have questions about intimacy and sexual activity. Special precautions may be needed while receiving this treatment. Now it says it's safe to hold hands and hug. It doesn't say you can kiss, which I'm not doing that either, but for those of you that might, like, can you make out with somebody? Maybe not, because it's bodily fluid. That's disturbing. That sucks. Wow. Like I said, nothing that affects me. I don't have anyone to make out with. Some cancer treatments can cause infertility. Talk with your provider about your options if you want to have children in the future. No, thank you. I will be passing on that. Okay, so that's that. So this is a 3-hour treatment every 3 weeks. To me, yeah, 3 hours. And then my other day after is a half hour, and that is 24 hours after my chemotherapy. Okay, here's the paper that I had to sign that says, possible side effects of these drugs include any of the following or a combination of the following. Allergic-like reactions, anemia, sensing weakness, bladder infection, constipation, diarrhea, dizziness, extravasation, whatever that is, fatigue, hair loss, hearing loss. I did not read that anywhere in this. Hearing loss. Did you? Heart damage, kidney damage, life-threatening complications, liver damage, loss of appetite, low platelet count causing bleeding. Pregnancy must be avoided during chemotherapy, obviously. Low white blood count resulting in infection. Lung damage, menopausal symptoms, already have those. Menstrual irregularities, already have those. Mouth sores, nausea and vomiting, numbness or tingling, skin and nail darkening, skin and eye light sensitivity. already have the light sensitivity, skin rash, skin ulceration at injection sites, secondary malignancies, sterility, visual changes, weight loss or gain, other. Drug, she wrote something here. Drug something, what? I don't know what she wrote. Well. So, my whole thing about doing chemo and my apprehension of doing chemo was not because I didn't want to get sick. And not because I didn't want my fucking hair to fall out. It was all the other shit that goes with doing chemo. Now, in movies and TV, you just see people doing fucking chemo, right? You don't see the other shit that goes along with it. You don't see, you might have heart damage. You might be sensitive to light. I mean, it's the lasting effects and the effects to my major organs and everything else. That was why I was so not excited or not knowing if I wanted to do chemo. And people were like, well, you have to do chemo because it's just what you got to do. And I'm like, it's fucking poison you're putting through your fucking veins and in your body and whatever else it does to you. So, yes, it kills the cancer cells, but it can do other potentially terrible things to your body. So, for anyone that's not ever gone through a cancer diagnosis and not have to investigate this stuff and not have to sign these waivers and be aware of what can come from chemo, I hope you never have to go through it because it's not an easy decision. Some people, I'm sure, they're just like, I'll do chemo, I don't care. And maybe it is because of the stage they're at, or they have family that they're worried about. Me, I was like, what's it gonna do long term to me? So that was my whole thing. And I still don't really want to do this. Like, I have 2 days to get right with it, and I don't want to do it. I still don't want to do it. And the same with radiation. I don't want to do radiation either, because I've got this horrible vision of just like this, such too many pictures of the radiation burns and stuff that just won't ever fucking heal, and it's just like, the radiation, because I don't know where they're going to put it, you know, because I'm assuming they're going to put where I had the lump, and then maybe with the lymph nodes. I'm assuming. I don't know. I've never been through this. So yeah, my family and friends that were thinking I was like stupid for saying I didn't know if I wanted to do chemo. You don't have to do chemo, okay? Like you don't have to do any of this shit if you don't want to. But there's going to be repercussions probably if you don't do it. You're going to get maybe you might get cancer returning. You have to go through this shit all over again. Maybe you won't. Depends on your body, depends on your genes, depends on your cells, depends on how far it had been in your body. Yeah, I don't have to do chemo. They can't force me to do it. Well, yeah, so that was the reason why, and people said I was crazy. They're like, what are you talking about? You should do chemo. I'm like, yeah, I know, but it's everything that comes after the chemo. Not just, I don't care about my hair. You see how short this is? It's going to grow back real quick. I don't care. Puking, I can deal with it. Hopefully, it's not going to be too bad, but it's everything that goes on with the rest of your body. And I'm not the healthiest person. Like, I'm not a super health nut, but I'm aware enough of what things can do to my body. And like I said, I'm a homeopathic person, so pumping poison into my body is not anything I'm excited about, and it goes against pretty much everything I'm about for myself. But I'm gonna do it, and I'll do it. I'll do it once and see how it goes. And hopefully, I don't ever have to go through this ever again. But It's very scary. And, I don't think I handle it very well. I've become very moody with people, and with people I don't want to be moody with. You know, they say you always hurt the ones you love, and because I'm hypersensitive, I'm taking things wrong, and I'm probably acting like a psychotic bitch. And I don't mean to. But when you're pretty much alone in dealing with things, and you're kind of terrified, things don't always come out in the best way. So, this is why I try to keep to myself. Because I don't want to have these mood swings or these anxiety attacks or terrorized moments come out and hurt people. Because that's what I'm doing. And I know some of them understand and maybe some of them don't. But I feel bad for coming off wrong. And these are all people that aren't in front of me. These are people that are far away from me or on the internet or in a different country, and like I can't be in front of them and I can't let them physically see why I'm coming off like a nutcase. Things don't translate well through text and online. Not always. So, I doubt they're watching, but if you are, and you're from another country, you know who you are. I'm really sorry. And I'm trying to tone it down, but I shouldn't be apologizing. Because, as I'm trying to show with these vlogs, this is shit that you go through when you have, I mean, not just cancer, but any kind of health issue or, you know, something like this that can affect you, you know. I shouldn't be apologizing, but I am, because that's how I am. Like, I don't really care what people think about me half the time, obviously. And I walk around like I don't, you know, I don't give one crap. But if you're someone I care about, I certainly don't want to hurt you. So this is like the longest video I've ever done. I'm going to try to edit some of it out, but this was a little, just, information that I've gotten from my doctors on what I'm going to be going through and everything that could happen. Not everything, but, you know, a rundown. So that was the whole point of this video. And, maybe if you watched it, you found it informative. Thanks for watching. Bye.